Guys, you're welcome again to my channel. This is a go to destination for orthopedic insight and practical knowledge skills. I am your tutor to Castagola. Welcome you all to this channel again. This is where I give you updates and knowledge concerning the management of fractures conservatively. So last class, I talked about the fracture management in collaboration with a first aid treatment. So when you find yourself at the scene of accident or you see a fracture patient trying to get means of survival and you are there as an orthopedic technologist or technician or a medical practitioner, so you have to get some basic knowledge that you need to get so as to rescue the patient from that accident scene. So that is why I made that lecture. So if you want more knowledge about that, how to rescue a fractured patient at the accident scene, get to that lecture. And I promise it's going to be a lovely one. All right, so today I'm going to be talking about uh, conservative management of Smith fractures. So Smith fracture and the causes, etiology, management, and how it happens, the mechanism of injury, and some other related things that contribute to this fracture I'm talking about. So last week or subsequent lectures, I talked about Colles fracture, and I said in that lecture that on Colles fracture, there is a fracture that happened on Colles fracture that has something to do with a Smith fracture. So if I want to talk about Colles fracture now that I've talked about in the previous lecture, I said Colles fracture occurs when there is a fracture to the radius, lower end of the radius, distal one to this aspect now. So, and I said that very time that there are two possible fractures that can happen on this same bone, this where I'm holding 2.5 centimeter below the wrist joint. So I said there may be Colles fracture and there may be Smith fracture. So there are two possible fractures that can occur there on the same bone at the same region. So what actually differentiates them is the displacement. One displaced towards one side, the other one displaced towards the other side. So, and I said that very day that if you want to talk about Smith fracture now, the one I want to talk about today, Smith fracture, you can say Smith fracture is a reverse Colles fracture. That is, when a Colles fracture is going to this direction, the Smith fracture must go in this direction. But they all took their roots from the same origin, the same scene. They came from the same place. So the fracture occurred on the same bone at the same region. It is fracture to the distal one third of radius, 2.5 centimeter below the wrist region. So two fractures happen there, Colles fracture and Smith fracture. But I said that very day that Colles fracture is when there is a fracture to the and the fracture is displaced towards the dorsal aspect of the hand. So if the fracture displaced towards this side now, the back side here, that's when you classify the fracture as a Colles fracture. But here I am today now talking about a Smith fracture. So when you see a patient sustaining a Smith fracture, there has to be some things that you are going to consider before concluding that, okay, this is a Smith fracture, this is not a Smith fracture. So a Smith fracture is a fracture that happened on the radius, lower end of radius, 2.5 centimeter below the wrist joint, and it is displaced volarly or ventrally. So when Colles is displacing over this place, Smith will displace over towards the dorsal, the side, palm side. So when you see an X-ray and the fracture is projecting to this side, you can sustain that confidence of saying, okay, this is a Smith fracture and not a Colles fracture. So this is what it takes to have a Smith fracture. So in general, in particular, we've talked about Smith fracture. In 1847, there was a man that came and brought about this knowledge of Smith fracture. He's an Irish surgeon, Robert William Smith. So he brought about this idea of Smith fracture, although the occurrence of Smith fracture was not up to that standard of Colles fracture. But in this he brought about this fracture and he highlighted some of the classifications, whereas some people later builded on that classification, and he gave us some possible management that is leading us to today. All right, so that is the basic knowledge about Smith fracture. Now, the etiology aspect of the Smith fracture, when I talk about etiology, I'm talking about what are the causes of Smith fracture. When you talk about Smith fracture can result by falling on the flexed hand. When you fall like this, it's going to cause Smith fracture. Don't forget when I talked about Colles fracture. Colles fracture is when you fall on the outstretch of hand. But this time around, when I'm talking about Smith fracture is when you fall on the flexed hand. So when you fall like this, the hand will look exactly like a garden spade deformity. So when you see a limb that has a Smith fracture, if you check the shape of the limb very well, it's going to present with something called garden spade, shovel that you use in normal shovel. So it's going to look exactly like garden spade deformity, garden spade. So that is why they call it a clinical deformity, which is called garden spade deformity. So when you see a hand in that manner, you definitely conclude that this is a Smith fractures. So quickly, let me talk about the classification of Smith fracture. Smith fracture can be classified into three. Classification of Smith fracture can come in three forms. It can be classified into three. All right, we have type 1 fracture, we have type 2, and we have type 3. Very simple one. Type 1 is the most commonest one. When there is a fracture that happened on the radius, the fracture happened on the lower end of radius, and I want to talk about the way they are projecting now. Some of them may include the joints, some of them may not include the joints, some of them may be an avulsion fracture. So when we are talking about that fracture now, number one, which is type 1. Type 1 is extra-articular fracture. When I say extra-articular fracture, the fracture will happen somewhere around this place and it will not include the joint. So that's why we call it extra-articular fracture. The fracture happens a way, it's not within the region of that wrist joint, outside the wrist joint. So it's not up to this side. The fracture may not extend to the joint, so it may just be here alone. The fracture is extra-articular fracture. And the second one is talking about intra-articular fracture. That's type 2. Don't forget I said type 1 is extra-articular fracture. That is, the fracture did not include the joint. The second one is intra-articular fracture. This fracture this time around includes the joints. That is, if there is a fracture, the fracture can go like this. So the extent that the fracture will include the joint. Joint will be included in this kind of fracture. And the third fracture is talking about juxta-articular oblique fracture. Juxta-articular oblique fractures. So when this fracture occurs, this one is not even intra-articular or extra-articular or whether it's joint or not. This one is whenever there's a fracture, it's going to be a little fragment of that fracture, of that bone that will be tear, just like an avulsion fracture. An avulsion fracture is when you have a condyles of any bone and a little part of the condyles of the bone is being teared away. So you may have fracture, you may have just slight fracture like this. It will just tear at the tip of the radius. So it's not going to be an intra or extra. So it's not about whether the fracture is including the joint or the fracture is not including the joint. So when you consider all these three things, the first one is extra-articular fracture, when that is the fracture is not including the joint. The second one is intra, where that is the fracture is included, and the third one is talking about juxta-articular. That is the fracture is at the edge of that bone and is tearing one fragment apart. So these are the classifications of Smith fracture. When you see all this, it can be done under Smith fracture. So talking about the management of Smith fractures, briefly, it can be done through a conservative method, and also it can be done through surgical method. In my next lecture, I will be talking about the full management, and I'll be talking about the full predisposing thing as far as this management is concerned. I'll be talking about the full etiology and the full causes of Smith fracture. So when we talk about the management of Smith fracture can be done conservatively by doing something we call extension. It's going to be in an extension form and it's going to be realigned. And mainly cast, there is a cast that is used for Smith fracture, which is called a Smith cast. That Smith cast is going to be a 90-degree flexion and supination. So the patient is going to be put on Smith cast after managing the fracture conservatively. So these are the general pattern for Smith fracture, from the causes to the etiology, from etiology to the management of Smith fracture, which is conservatively. So in my next lecture, I will be talking about the full pattern of what you can use, the full expectation of what you should be expecting from a Smith fracture, and how you will treat a Smith fracture, and what are the possible complications that may come from this Smith fracture. All right, guys, that will be all for today. Don't go without subscribing, because it is only on this channel I give you updates concerning the conservative management of fractures. All right, do well to share, do well to subscribe, and do well to like this video. Don't forget, in my next lecture, I'll be talking about Smith fracture in general. What are the things you should expect from 0 to 100 as an orthopedic technician, as an orthopedic technologist, and as a medical student or as an health worker? You want to know the deal. What are the things that comes together to form a Smith fracture and how you are going to be built out of Smith fracture? Watch out in my next lecture. I'll be giving you details on that. All right, guys, that will be all for now. See you in the next class.